So let's take a look at the latest. And there is no one better to talk with me about this than Dr. Brian Harrington. Doctor, how are you doing this morning?
I'm okay, Eric. Good to see you. Things are moving fast here recently.
They sure are. Let's talk about that.
So we have seen you could even qualify as an exponential rise. No matter what word you want to use, we've seen a dramatic rise in cases in Routt County. I mean, the last 2 weeks, we've had 90 cases. That's quite literally a third of our total for the year that we've documented just in the past 2 weeks. This and 64 in the last week. So this is, I don't want to say it's getting out of hand yet, and it's not, but this is very concerning. Look at it this way. If we increase our case counts by 20 or 30 a week, which is what we've done here recently, we could easily be over 150 cases a week, even maybe by Thanksgiving. And then you add in the gatherings that people may choose to do, college students coming home, all those things. And if we see another bump like we did on Labor Day and July 4th, I just feel that we'll be at an untenable level. Our case positivity rate is up above 5% now, which is a danger mark. And I mean, obviously, our case counts are way up, and we're not unique. In fact, we're better off than some other places in Colorado, but overall, the state and the nation are not doing well with their counts. Hospitalizations are increasing now. We have multiple people hospitalized with COVID-19. Not every one of them was admitted because of that primary diagnosis, but it's playing into what's going on with them. That's what we expect. When we see a rising disease prevalence, some percentage of those people are going to be critically ill and require hospitalization. Plus, this affects other people coming in for routine things. So we're at a dangerous spot, and the fast rise has, I think, caught everybody's attention.
So that puts us in a high risk category. What are some of the restrictions that come with a high risk category?
So we've been in. I mean, we've met the numbers for safer at home level 3 now for a couple weeks. Last week, when we talked to the state, they had a specific discussion with us about even moving us to level 3 right away. We chose to move to level 2. Take this step by step, but in a very, I guess you'd say, fast way. And so, wanted a few days for that to sink in and to work and to look at level 3. Give people, businesses in particular, a chance to kind of ponder rearranging work plans. So moving into level 3 has a variety of restrictions. I might just refer people to the state website, but on all business areas, there's differences in group gatherings, there's differences in recreation, there's differences in restaurant capacity, differences for churches. Nothing is totally banned, I would say, but these restrictions now are going to start really crimping. I think a lot of people have figured out how to get by here in the summer and fall, but now we're moving to a different level of restrictions. And after this, the next step, at least in the scheme of things, would be stay at home. I can tell you that none of us in public health have desired to go to that kind of draconian end result. We're trying to figure out ways of doing things short of that. So part of that is moving along the scheme defined by the state, which they, quite frankly, will push us along. And then in addition to that, we've tried to use our own data to decide, is there a particular thing that we could focus on here locally that would be the winner? And unfortunately, there is no one thing. We are seeing this disease in all age groups, in various business sectors, in various recreational activities. We're seeing it with homes and gatherings. It's percolating, as I say, throughout the whole community, infecting everybody. So it's incumbent then on all of us to do our part, just because there is nobody who's kind of immune from this or not, able to contribute to the reduced transmission of it. So while we have outbreaks, we've talked about, we've had quite a few high school students here recently that tested positive. And yes, it appears that these are related to a couple activities that many of them were involved in. Yes, these are activities that we would advise people not to be doing in the first place. Yes, it's important that we all understand how the disease is being spread. But then I want to qualify that by saying that our lens is not on just a single group of people. I mean, as I've previously said, we're seeing this disease coming out in all aspects of our community. So no one group or individual is to blame or the cause of what's going on. This is happening collectively amongst us in the community, and we all need to do our part.
Yeah, I was looking at the pie chart that the county just released this morning, I believe, or this week, I should say, where actually it said the percentage of businesses are the spread. They track the spread, and it said this percentage came from business, this percentage came from restaurants, this percentage came from social gatherings and stuff like that. And I think you said it right when you said it's not there's a piece of the pie that goes to a bunch of different places rather than just one. Like 90% of the cases are definitely coming from X. It's not that way. It's just spreading.
Right. And you can get the disease even in spite of your best efforts. So just because somebody contracts COVID-19, no way implies that they're being irresponsible or did something wrong. We need to take lessons, yes, and only be responsible for our actions. But I think the bigger picture is just how widespread this is and how much at risk we all are. And therefore, every one of us has things that we can do individually. I made a plea today at our Board of Health meeting. I said, look, I just ask everyone in the community, choose 3 things that you will do and that you'll act upon to make a difference. And so, forego dinner with the neighbors. If you're going to travel to Denver this weekend, don't do it. If you are planning to do some kind of, if you're going to hang out with friends, don't do it. Those are kind of personal choices which can make a difference. And so choose 3 things, commit to 3 actions each week that you can do differently. And I think that will get us doing better. Again, I don't know if there's some magic thing out there. Really, I think we know the things that are effective. We somehow got to overcome our fatigue with all this. And, I know we've all made sacrifices. We've got a few more months of this to go, though.
I think that's a great way of tackling it and looking at it really. It's because instead of saying the same, 12 demands, stay 6 feet away, wear a face mask, you're kind of making it more bite-sized and something that you can be more specific about, like commit to 3 things. Don't go to Denver this weekend when you had plans. And as long as we each can do it, it's kind of that pay it forward butterfly effect where even if we each commit to just those 3 things, it can have a big impact on our community. So thank you for saying that. Lastly, I want to wrap this up with the vaccine talk. What is your opinion on these vaccines?
We will, I think there's a good chance that I will see a vaccine vial in my fingers by the end of December. We're in active conversations with the state health department. Roberta Smith, our public health director, is actually working on the plan that the state's put out, which will be a 3-phase plan. The first phase will rely on immunizations being distributed through public health. We'll prioritize first-line healthcare workers, vulnerable populations like at nursing homes. And my belief right now is we may start to see a trickle of that stuff by the end of December. I think, though, realistically, for the bulk of our population, it's still many months away before we'll have a significant supply of vaccines that allows us to kind of move down this prioritization tier and give it to healthier people. Certainly, there's a scheme that's been played out, like our second phase has teachers. They're top of it because they're considered critical. But again, I don't know that we're going to see the number of vaccines in order to reach that level until, who knows, maybe February or later. But maybe I'll be pleasantly surprised. You've all heard, I think, news this week about the Pfizer vaccine. I haven't seen the numbers exactly. I'm always a little, I guess I should say, critical about statistics when they're reported because it's often hard to present them correctly. But it does sound promising, that's for sure. And I'd also highlight that this information came from an independent committee. So there's quite a few checks and balances in this vaccine development process, including that the data is reviewed by an independent committee. They're not employed by the companies or necessarily government or anything. And they unblind the data and take a look at it and decide, oh, look at this. This is actually noteworthy. So that's good news. We want that. We're looking for some positive news amidst all this. And we could see the Pfizer vaccine receive emergency use authorization here in December. If and when that happens, I'm sure I and everybody else is going to look critically at the information to decide, is it effective? Who's it most effective for? Is it safe? What side effects do we have to watch out for?
Excellent. Well, not a great week, but I really do thank you, Doctor, for joining me on air this morning.
Yep. So in the midst of, I'm trying to remember the right quote, but in the midst of despair, there is opportunity. We have opportunities here. Our community can overcome this. So I want to try to maintain a positive message out there for folks. It's not all doom and gloom. Don't give up, but just strive to make choices in your own kind of personal environment that can make a difference.
Thank you.